Imagine waking up and having an incredible pain in your hip. You go to your doctor. Your doctor diagnoses you with femoral acetabular impingement, or FAI. Now you're wondering, what do I do? What are my options? Like you, I was in a similar situation a year ago when I was diagnosed with FAI. Anyone can have this disease, so it's important to have a basic understanding of what this disease is. FAI is a rare disease that is commonly being diagnosed. It is important to understand this condition, and I'll help explain this to you by explaining what it is, what causes it, and the treatments for it. First off, what is FAI? FAI is a bone condition that is in the hip. It could be separated into 3 different forms. The first form being pincer. Pincer is the part that affects the socket of your hip. Your hip is a ball and socket joint. Your socket has this extra growth on it, such as with this Barbie doll. She has extra clay on her hip, allowing her not to be able to move, and as she rubs, it creates friction, so she can't move as well as with the other hip that does not have clay in between it. The second one is cam. Cam is where the ball is misshapen, so it doesn't fit perfectly into the socket, tearing up more cartilage and more tissues inside of there. And the last one is combined. This is where you have both of them together, tearing up cartilage and tissue. Now, if you don't get this treated, it can cause a lot of big problems in the future, such as arthritis. Osteoarthritis can trigger hip pain, tenderness, stiffness, and less flexibility. If nothing is done to correct this severe hip impingement, these conditions likely will continue to worsen. As they do, hip discomfort, pain, and other symptoms increase. Dr. Aaron Critch, Orthopedic Surgery, Mayo Clinic, Rochester, Minnesota. Now that you have an understanding of what FAI is, you can understand what causes it. FAI is a hard to place cause because it can either be caused by hereditary or just being born with it. With hereditary, it can be passed down from your parents to you. With being born with it, you could just naturally have your bones grow to where they don't fit with each other. As with, according to Washington University Orthopedics, it can occur in people of all ages, including adolescents and young adults. So anyone can get it. But finally, you will want to understand what treatments are available. FAI has a range of treatments for anyone. The first one being non-surgical. Non-surgical would consist of physical therapy, strengthening the hip muscles so that they can support your hip bones better, so they don't rub and create that friction with each other. The other one is taking ibuprofen, which is an anti-inflammatory, or any other anti-inflammatory. The other way is changing your schedule. If running creates that friction inside of your hip, then I recommend slowing more or less of your running to create less of that friction and tearing up your bone. Then the final one is the most common and most recommended, which is arthroscopy surgery. This is where they take a camera into a penny-sized incision inside of your hip, look around inside of your hip, make another incision, and cut off the chunks or extra growths on your bones. Then the doctor can also put in other tools to regrow your cartilage or repair the tears inside your hip bone. As one doctor puts it, this results in less pain for patients, less joint stiffness, and often shortens the time it takes to recover and return to favorite activities, ortho-info. As well as arthroscopy has helped physicians and researchers better understand many hip joint problems, as surgical techniques endure. It is anticipated that hip arthroscopy will play a greater role in diagnosing and treating hip disease, arthroinfo. So, FIA is a disease that is becoming more commonly diagnosed. I have explained this through what causes it, what treatments are available, and what it is. I leave you with to be aware of different diseases that are out there, like this, that are becoming more increasingly diagnosed. Thank you.